Hi there, I have 14 test questions on the psychiatric aspect of alcohol use disorder. Ready? Let's learn psych fast. Question 1. Which medication is associated with the risk of adverse reaction if alcohol is consumed while taking it? Is it A, acamprosate, B, naltrexone, C, disulfiram, or D, topiramate? The answer is C. All right, we're talking about the tough one, disulfiram. If someone decides to have a drink while on disulfiram, it's like flipping a switch. This medication is associated with the risk of severe adverse reaction when alcohol is consumed. I mean, we're talking about reactions that can make you seriously regret that sip. It's a little bit of a built-in deterrent to keep individuals on track with their abstinence goal. Acamprosate Option A is wrong. It is more forgiving, though. It's not known to cause any severe adverse reactions if someone happens to drink while taking it. It's more of a maintenance abstinence. Naltrexone is in the helpful alley, but it does not unleash that severe adverse reactions if alcohol is consumed. Its focus is more on reducing the cravings. Topiramate isn't the strict enforcer like disulfiram. It's not associated with severe adverse reactions either in response to alcohol ingestion. So when we're talking about playing hardball with alcohol consumption, disulfiram takes the lead, making sure that if you're on it and you have a drink, it isn't just a casual decision. It comes with serious consequence. Question 2. Which factor is not a consideration when selecting an appropriate medication for an individual with AUD? A. Co-occurring psychiatric disorders. B. Severity of alcohol dependence. C. Patient's preference. Or D. Dietary preference. The answer is D. Dietary preference. All right. When we're in the business of choosing the right medication for treating alcohol use disorder, we're looking at a bunch of factors. However, dietary preference don't typically take center stage. It's more about considerations like co-occurring psychiatric disorders and the severity of alcohol dependence and patient's preference that guide the choice of medication. So looking at the other options, co-occurring psychiatric disorders, this is a big one. The presence of other mental health issues can influence the choice of medication, so it is crucial to address the whole picture of the patient. B, the severity of alcohol dependence. Absolutely. The severity of AUD matters. It helps determine what level of intervention is needed and the choice of medication that aligns with the individual's needs. C, the patient preference. Yeah, well, patient input, it does matter. Some medications may have side effects that individuals find more tolerable or more preferable, influencing the choice of treatment. So when it comes to selecting the right medication for AUD, it's like putting together a puzzle where dietary preference might be a piece, but there are other more prominent pieces to consider in the decision-making process. Question 3. In the context of relapse prevention, what role does motivational enhancement therapy, MET, play in AUD treatment? A. Improving cognitive functions. B. Enhancing readiness for change. C. Modifying maladaptive behaviors. Or D. Stabilizing mood fluctuations. The answer is B. Enhancing readiness for change. All right. When we're talking about avoiding the slip-ups and maintaining the hard and earning sobriety, motivational enhancement therapy steps up to the stage. MET is like a personal coach working on boosting individuals' readiness for change. It helps individuals find their own motivations and strength to stay on the path of recovery. Let's review the other options. A, improving cognitive function. Well, MET is not so much about enhancing cognitive functions directly. It focuses more on the motivational side, sparking the internal drive for change. C, modifying maladaptive behaviors. While behavioral changes are part of the journey, MET's primary role is enhancing motivation rather than directly modifying behaviors. And then D, stabilizing mood fluctuations. MET doesn't function as a mood stabilizer. Its magic lies in tapping into motivation and helping individuals build their own resolve for lasting change. So, in the world of relapse prevention, MAT is the coach in your corner, revving up the internal engine and getting individuals ready to face the challenges of staying alcohol-free. Question 4. What is the primary purpose of utilizing stepped care approach in treatment of AUD? Is it A, minimize treatment costs, B, maximizing immediate abstinence, C, tailoring interventions to individuals' needs, or D, reducing the duration of treatment? The answer is C, tailoring interventions to individual needs. All right, when we're talking about a stepped care approach in treating alcohol use disorder, it's like having a personalized toolkit. The primary purpose is to tailor interventions based on individuals' needs. It's not a one-size-fits-all scenario. The stepped care approach allows for flexibility, ensuring that the level of intervention matches the individual's specific requirements. Option A, minimizing treatment costs. While efficiency is essential, the primary goal of a stepped care approach is not solely about cutting costs. It's about optimizing the effectiveness of interventions. Option B is incorrect, maximizing immediate abstinence. Stepped care recognizes that individuals have different needs and readiness for change. It's not about pushing everyone towards immediate abstinence, but rather finding the right level of care for each person. And then D, that's wrong, reducing the duration of treatment. The stepped care approach acknowledges that the treatment duration can vary based on an individual's progress and needs. It's not a rigid approach focused solely on reducing treatment duration. So, when it comes to treating AUD with a stepped care approach, it's all about customization, tailoring the interventions to fit like a glove, meeting individuals where they are in their journey to recovery. Question 5. Type 1 Male-limited alcohol dependence has which of the following characteristics? A, guilt, B, psychological dependence, C, late onset, D, B and C, or E, all of the above. The answer is all of the above. All right, let's dive into the traits of type 1 male-limited alcohol dependence. This category brings a mix of characteristics, including feeling of guilt, a stronger presence of psychological dependence compared to physical side, and fashionably late onset. Question 6. Which of the following best represents the percentage of adults in the U.S. who meet the criteria for an alcohol use disorder? Is it A, 0 to 1%, B, 2 to 4%, C, 10 to 15%, or D, 30 to 40%? The answer is C, 10 to 15%. Although estimates vary across the various studies, about 13.9% of adults in the U.S. meet the criteria for an alcohol use disorder, either abuse or dependence, in any given year. Choices A, B, and D are incorrect. I remember this by picturing a drunk walking on 10 toes while holding an alcohol drink with his 5 fingers, thus 10 to 15%. Question 7. Which of the following occurs at a higher rate in men than women? A, binding of alcohol to GABA receptors in the CNS. B, excretion of alcohol unchanged in urine, sweat, and expired air. C, gastric metabolism of alcohol. D, metabolism of alcohol by the liver. The answer is C, gastric metabolism of alcohol. Alcohol dehydrogenase, that enzyme in the gastric mucosa, it accounts for some of the alcohol metabolism. The gastric alcoholic dehydrogenase activity is higher in men than women. And, choices A, B, and D not significantly different between men and women and are therefore incorrect answers. Question 8. What is the primary goal of pharmacotherapy in the treatment of alcohol use disorder? Is it A, complete abstinence, B, harm reduction, C, controlled drinking, or D, temporary sobriety? The goal is A, complete abstinence. All right. So we're treating alcohol use disorder with medications. Our main is usually to go for the gold, which is complete abstinence from alcohol. It's like setting the bar high for patients to kick the habit altogether and have a booze-free life. B is wrong. While harm reduction is a valid approach in some contexts, the primary goal in psychotherapy for AUD often leans more towards a full stop, getting rid of alcohol use entirely. C, wrong. Controlled drinking is wrong. Similar to harm reduction, controlled drinking might work for some, but the primary goal with medication is usually to steering clear of alcohol intake altogether. Again, D, wrong. Temporary sobriety. No. Again, we're aiming for the long game here. So temporary sobriety might be a step, but complete abstinence is the big win we're chasing with medication interventions in AUD treatment. It's like going all the way for lasting changes. So in the world of AUD treatment, we're looking at saying a firm no to alcohol use, and that's why complete abstinence takes the lead and is the correct answer. Question 9. Which medication is commonly used to reduce alcohol cravings and promote abstinence in individuals with AUD? A, naltrexone, B, benzodiazepine, C, disulfiram, D, acamprosate. The answer is A, naltrexone. All right, when it comes to curbing those intense cravings for alcohol and nudging folks towards abstinence, naltrexone is a star player. It's like the superhero that helps cut down the desire for alcohol, making it easier for individuals to stick to their abstinence goal. While benzodiazepines are used in certain contexts, they're not the go-to for reducing alcohol craving in AUD. They have their own role, especially in managing withdrawals. Disulfiram takes a different route. It's more about creating an aversion to alcohol by causing an unpleasant reaction if alcohol is consumed. It's not the direct craving reducer like naltrexone is, though. Acamprosate does play a role in AUD treatment, but it's more about maintaining abstinence rather than directly reducing the cravings. So naltrexone is the one specifically known for curbing that urge to reach for the bottle. So when it's about saying no to persistent cravings, naltrexone steps up as the go-to medication in the toolkit for treating AUD. All right. Question 10. Which subtype of alcohol dependence is characterized by its use for mood regulation and helping to ease social relationships and is more common in women? Is it A, developmentally cumulative alcoholism, B, developmentally limited alcoholism, or C, negative affect alcoholism? The answer is C, negative affect alcoholism. It's a type more prevalent in women than in men. And in this scenario, women are more inclined to turn to alcohol as a way to manage their moods and navigate social interactions. It's like a distinctive pattern where alcohol becomes a coping mechanism, and understanding these nuances is part of the rich tapestry in our exploration of alcohol-related behaviors, especially in the context of women's experiences. Question 11. Which neurotransmitter system is targeted by medication like acamprosate in the treatment of AUD? A, GABAergic system, B, glutamatergic system, C, dopaminergic system, or D, serotonergic system? The answer is the glutamatergic system. Acamprosate does its magic by interacting with the glutamate neurotransmitter system, helping to keep things in balance and supporting individuals in their quest for abstinence. Option A, the glutamatergic system. While GABA is a major player in the brain's inhibitory process, acamprosate doesn't directly target the GABAergic system. It's more like a dance with the glutamate. It's all about glutamate. And C, this is incorrect. Dopamine is often used in the spotlight when we are talking about reward and pleasure, but acamprosate doesn't specifically mess around with the dopamine neurotransmitter system. Again, its focus is on glutamate. Option D is incorrect. Serotonin has its own role in mood regulation, but acamprosate isn't the neurotransmitter for serotonin. Again, glutamate it is. So, in the intricate dance of neurotransmitter, Acamprosate takes a twirl with glutamatergic system, helping individuals find their footing on the path to abstinence in the world of AUD treatment. Question 12. In the context of AUD treatment, what is the mechanism of action of disulfiram? A. Enhancing GABAergic transmission. B. Inhibitory acetylcholinesterase esterase. C. Blocking alcohol metabolism. D. Modulating glutamate receptors. The answer is C. Blocking alcohol metabolism. All right. When it comes to disulfiram, thinking of it as a guardian at the gate. That's what you should think of it as. Its main gig is to block the metabolism of alcohol. So if someone is on disulfiram and decides to take a sip of tempting beverage, they're going to have a very not so pleasant surprise because their body won't be able to break down the alcohol the usual way. And it's like a built-in consequence to deter drinking. The others are incorrect. Enhancing GABAergic transmission. Disulfiram isn't a boosting of the GABA system. It focused primarily again on the metabolism of alcohol, not ramping up inhibitory neurotransmission. Does not affect the inhibition of acetylcholinesterase esterase, so B is incorrect. It doesn't work on that enzyme at all. And then D, modulating glutamate receptors. While glutamate is a major player in the brain, for this medication isn't directly tweaking the glutamate receptors. Its primary game is on alcohol metabolism arena. So when we're thinking about this medication, you want to think of it as a gatekeeper, ensuring that if you do decide or your patient decides to drink, your body isn't going to be able to process the alcohol the usual way. So it's just a clever way to discourage alcohol consumption in the context of AUD treatment. Next question. Question 13. Which psychosocial intervention commonly used in conjunction with medication for the treatment of AUD? Is it A, DBT, B, CBT, C, EMDR, or D, psychodynamic therapy? The answer is CBT. All right. When we're navigating the world of alcohol use disorder treatment, it's also tag teamed with the effort of medications along with the psychosocial interventions. So one of the heavy hitters in this combination is cognitive behavioral therapy. It will help individuals to identify and change unhealthy patterns and behaviors related to their alcohol use. It's all about rewiring that brain for a healthier relationship with alcohol. DBT, dialectic behavior therapy, it's a great technique, but not for AD. It's usually used for areas of emotional regulation. EMDR, eye movement desensitization and reprocessing, that's a powerful one for trauma-related concerns. So you want to think of that one more like for trauma, PTSD. And then D, psychodynamic therapy. While psychodynamic therapy does have its merits, especially in exploring unconscious processes, CBT is often chosen to be a more structured and goal-oriented approach that is better suited for AUD. So when it comes to therapy for alcohol use disorder, select CBT on that test. Question 14. What is the recommended first-line approach for the management of alcohol withdrawal syndrome? A, clonidine, B, benzos, C, opioid agonists, D, antipsychotics. The answer is B, benzos. That's the one time we're going to select benzos. Not that often, but this is the time. All right. When it comes to handling alcohol withdrawal, benzodiazepines often take the spotlight as the first-line heroes. They're like the peacekeepers that's going to calm down that nervous systems that's just flaring up because of withdrawal. Benzodiazepines mitigate the risk of seizure and severe symptoms that can tag along during alcohol withdrawal. Clonidine, it does have its merits, but it's not the go-to for the initial stages of alcohol withdrawal. And then opioid agonists, nope. We're not bringing opioid agonists to the party. Benzodiazepines are a safer bet for alcohol withdrawal symptoms. And then D, that's wrong. Antipsychotics, while antipsychotics have their role in certain situations, they're not typically the first line choice for managing alcohol withdrawal syndromes, such as benzodiazepines in this scenario. So when it comes to the initial approach of alcohol withdrawal, benzodiazepines are often the trusted allies, ensuring a smoother ride through a potentially rocky phase. All right, you've made it. I hope you do well on your test. Share this with your classmates so they too can be successful in their studies. And go ahead and just click on this next video. I think this will be a good one for you. Thanks.